Welcome to Mom Days, a weekly health chat with local moms just like you.
Okay, moms, we're going to do something a little different this time. We're going to take a quiz. I'm calling it the Cough, Cold, Stuffy Head Quick Moms Quiz. We're going to ask questions to our fabulous moms, and then in the end, Dr. Hendrix is going to join us and tell us how we did. So the first question is, how do you stop a child's cough?
Well, I have learned many different tips from other moms. I do the vapor rub on her little sinuses, on her feet. I actually invested in a home nebulizer. So when she's coughing at night, right before she goes to bed, I put it on for 10 minutes and it really works miracles.
We also do the vapor rub on the soles of the feet and the chest if they're old enough, and then bring them into like a steamy bathroom, run the shower, and then I just cross my fingers and hope for the best.
Good old-fashioned honey. It works every time. It works if your kid likes honey.
Yeah.
And they're not allergic to it too. But yeah, no, for my daughter, honey works every single time.
That's a good one, I forgot.
Yep. And of course, elevating them when they go to sleep. And
Oh, yeah.
They also have these plug-ins now. Have you seen the vapor plug-ins? And you buy the little refill pads, and it aerates in the room. That menthol kind of smell, and that seems to help too. So, but honey.
That's so good to know. That's why we need each other, because we're like, I haven't thought of that. I forgot about the honey too.
It is back to basics, and it works the best.
So as far as coughs are concerned, the moms are right on the money. Vicks Vapor Rub, although not necessarily applied to the feet or the chest, it's just the effervescence. Camphor and eucalyptus are good to help soothe the irritated throat that triggers coughs in kids. But also, it's very important to remember that you shouldn't use any over-the-counter cough syrups in children under the age of 6 because the risk of side effects is just too great. So an alternative is honey. So again, right on the money there that honey works really good, not in children under the age of 1. Another caution about the honey is that it can cause infantile botulism, unfortunately. So older children, toddlers over the age of 1, honey is a good alternative, and it's been proven by several studies to be as effective as many of these over-counter cough syrups without any side effects, other than a little bit of a sugar surge, I guess, and a kid bouncing off the wall.
Next question. So you look in your child's throat and their throat is yucky looking. When do you know to go to an urgent care center? What are you looking for in the throat to know, we gotta go?
Well, how irritable it is, if it's like really red, or even you can at times see some of that pus. But really for me, it's just what I'm hearing, you know, how her lungs are sounding, to really determine how she slept the night before. Those are all things that I'm like, okay, it's time to go to the doctors. Glassy eyes, you know, she looks just really tired, low energy, like it's time to go.
I always err on the side of caution. Even if I see just a little redness in the throat, I'm the person that's immediately going right to like urgent care, because I want to make sure that we kind of nip it in the bud. So I don't have any medical experience, so I just have to go with that, like first instinct, like you said, and knowing how they slept the night before too, or how they've been acting in general. But I think it's always better to just take them, just in case.
So they know you by name, and you're handing your copay credit card right when you walk in the door.
My husband's like, how many times are we going to go to urgent care this month? I was like, well, aren't you glad they're right here?
It's true, and it's so easy.
It is, definitely.
Why not? And better safe than sorry. I mean, especially with
Absolutely.
young kids that can't communicate all of their needs
That's
to
when
you.
it's super hard, yeah.
It's for the mom too. It's just our peace, knowing, okay, I've taken them to the expert.
Right.
They're
Especially
okay.
before the weekend too, but always gauge by fever. Obviously, if there's a fever, I bring them right in. But then you treat the symptoms, and if treating the symptoms prophylactically with ibuprofen and all that kind of keeps it at bay and it doesn't progress, then they're fine. But unfortunately, a lot of times it progresses and they'll wind up with an ear infection, and then you just kind of go with those symptoms, and then always your mom gut. That always winds up taking us into, the urgent care center is the mom gut, but yeah.
And I love that. They know that they're like, okay, mom, you think something's wrong. We're going to believe that. That's something
Absolutely.
wrong.
Most of the times we're right.
I feel like 100% of the time. I try not to tell him that, because I'm like, remember last time? But you're familiar with how your child acts typically, right? You know when they're acting a little differently. And if you don't do it and they feel worse, then you have to deal with a whole new set of issues. So
You know your kids best. So.
When a kid has a sore throat, it can be very difficult to determine if it's strep. looking in the throat is very deceptive also. And I joke around with patients and say 50% of the time I'm right when I look in a throat that has white stuff on the back. Oftentimes, viruses will cause that appearance, so it doesn't mean it's strep. And the only way to really determine if it's strep is to test it. So it's a good idea if your child is suffering from a sore throat, meaning they're having problems swallowing, it's painful, they're running a fever, that may also be a good indicator. But a lot of that could still be virus. So the only way you can tell is to go to urgent care, go to your doctor, and run a quick test. About 5 minutes, we'll be able to tell whether it's strep or not. If it's a virus, that will just have to run its course, unfortunately. It's a matter of keeping the child comfortable with that throat pain. But if it's strep, we can put them on the antibiotic to shorten the course and make them feel better within a day or two.
Okay, so a cough combined with what means you keep them home from school?
Fever.
Fever.
I think Dr. Hendrix is going to agree with that. What do you guys think? I think so. Okay.
There's a lot to be said for mother's intuition. Moms know when their kids are sick, and they usually can tell when they need to stay home from school. But a fever is a good indicator, especially in the wintertime during flu season. If they're running a high fever, there's a good chance it's going to be influenza, and they need to stay home until they're at least 24 hours free of that fever so they're not spreading it around at school.
What virus do you think your child has if they've been coughing for a couple days?
The norovirus. It used to
Bubonic
be.
plague. No,
I know, right?
I go worst case scenario. I'm worst case scenario.
It used to be rotavirus, but they get immunized. Most people get immunized against that now, so you don't see that often. But the norovirus is that one with the cough that lingers. You're in day 7, you're in day 8, you're in day. They usually say by day 10 it should be resolved. But yeah, the norovirus, and they just pass it around the classroom.
I didn't know that actually.
It goes around like crazy. How do I know this? Because I took her in.
Yeah, that's what you learn when you go to urgent care.
Yeah,
I tell you, especially now around this season, you know, during the winter, even in Florida, then the virus goes around if they are in daycare or in school. So I cannot stress enough to my 4-year-old Valentina, wash your hands, don't put anything in your mouth, don't put anything on your nose. Valentina, I'm hearing, I would drop her off and I'm hearing other kids cough, and I'm like, wash your hands and stuff like that. So interestingly enough, last time around, I think she started listening because she was one of the few kids that didn't get it in the classroom.
I'm always like, too, and we love nobody today. We hug nobody. We love don't touch anybody today.
Yeah, and you hate to like go overboard with it, but you have to be a little careful, especially when you have younger kids in the house. They're bringing that stuff back.
And you're creating habits, you know what I mean, that is going to ultimately last forever.
And hopefully they bring it home to the parents, because ultimately it's the parents' decision whether they keep their kids home from school. And it's a courtesy for not only the children in the class with them, but also for the parents, because who wants their kid to be constantly sick? So you hope that the parents kind of abide by the same rules that everyone else does, and if we can all do that and encourage that, then maybe there'll be less sickness in the classroom going around.
And the teacher hopes so too.
Actually, the most common virus that causes the common cold is rhinovirus. There are several other viruses, and in fact, there's over 200 different types of virus that can cause cold symptoms, which is why the cold is so hard to develop a vaccine or treatments against, because there's many different viruses that can mutate or change and cause these symptoms. But usually it's the rhinovirus. And the thing about these viruses are that they will run their course in a week or a couple of weeks at the most, and there's really nothing you can do. Now, if it is influenza, we do have antivirals like Tamiflu that can shorten the course, but most of the time with a child, it's going to be about a week. It's just a matter of keeping them comfortable and applying plenty of maternal TLC. If you have any concerns, Centra Care is there, available 7 days a week. We have evening hours, extended hours at several of our offices. We have experienced, skilled physicians and practitioners there that can make a diagnosis and decide if something more serious. So if you ever have any questions, we're there to help.